Good morning. Thank you. I've been asked to talk about hypertension. It's a huge subject, and I'm glad I was only asked to present on the diagnosis because I don't think it can be completed in one session. I think all of us know hypertension is the leading cause of death and premature morbidity worldwide. And for us as cardiologists, it's the primary risk factors for coronary artery disease, but apart from that, for cerebrovascular disease, for heart failure, for chronic kidney disease, and for dementia. Worldwide, it affects more than 20% of the adult population. Over the past 5 years, the one fact which is concerning for us is the burden of the non-communicable diseases is shifting from the developing world towards the underdeveloped world, which is going to affect us more and more. And specifically in South Asia, with our dense population, with the poverty, with our might be genetics, with our diet, we are more at risk. We are the hardest hit region in the underdeveloped countries. If you talk about our country, Pakistan, 19% of the people in the country have hypertension, with every third person over the age of 45 being hypertensive. But of more concern is we are not diagnosing all of them, and even if we diagnose them, more than 50% of them go untreated. So there's something we need to do about it, and I think the first starting point will be to define hypertension accurately. So how do we define hypertension? Hypertension is the level of the blood pressure at which the benefits of treatment, be it the lifestyle modification or the medications, they unequivocally outweigh the risk of the treatment. And this benefit should be proven, and this level of the blood pressure should be proven by documented trials. So once we have defined hypertension, we need to have some guidelines. And luckily for us, various societies have come up with the guidelines, and we'll be looking at a few of them. The main one which is being talked about is the ACC and the American Heart Association guideline of 2017. The most updated ones are the ESC guidelines of 2022. Then the Hypertension Canada guidelines, 2017, updated in 2020. And the one very useful document that I came across is the Pakistan Hypertension League guidelines, which were drawn up in 2018. They closely follow the Hypertension Canada guideline with some input from the ESC guidelines, but they are brilliant. They are something which is very much applicable to our population. And I would suggest everyone to have a read of the third National Hypertension Guideline, which came up in 2018. So basically, when we want to diagnose hypertension accurately, we want to look at the ACC guidelines, the ESC guidelines, and the Pakistan Hypertension League guidelines, which go in line with the Canada Hypertension Society guidelines. I'll briefly look through the categories of blood pressure according to the to these guidelines. American guidelines, and they usually go hand in hand with the Canadian guidelines. And so I would, from now on, I would call them the North American guidelines. So they're a bit more strict with their diagnosis of the hypertension. They call the normal blood pressure less than 120 over 80. Anything over 120 over 80 is going to be elevated blood pressure. Then they diagnose hypertension if someone's blood pressure is 130 over 80. So anyone who has a blood pressure of more than 130 over 80 is hypertensive. And then they divide them into two stages, stage 1 and stage 2. If you talk about the ESC guidelines, they're a bit more relaxed in initial diagnosis of the guidelines. And I think the initial is the key word, because later on they become strict once the hypertension is diagnosed. So they call less than 120 over 80 optimal blood pressure, but up to 130 over 85 is a normal blood pressure according to the ESC guidelines. Then they go on to the high normal blood pressure, which is up to 140 over 90. And their diagnosis, the cutoff for a hypertension diagnosis starts beyond 140 over 90. But I will come to that, then they change once the blood pressure is, the hypertension is diagnosed, then they become a bit more strict. Then they divide their hypertension into 3 grades, grade 1, grade 2, and grade 3. And then they also have a separate category for isolated systolic hypertension. As I mentioned, the Pakistan Hypertension League recommends mostly the guidelines, which are based on the Canadian Hypertension Society guidelines, but they have taken a good input from the ESC guidelines as well. So a couple of algorithms, I will briefly mention them. So this is the Hypertension Canada algorithm for diagnosing the hypertension. But very good work was done by the Pakistan Hypertension League. And I find this one more useful in diagnosing the hypertension in our local population as compared to the Canadian model. So while diagnosing hypertension, anyone who checks their blood pressure, be in their home, be in a clinic, or be in any setting, and if their blood pressure is more than 110 or 100, more than 180 or 110, they are diagnosed hypertensive. If not, if they are less than 180 or 110, they suggest not rushing into a diagnosis, but arrange a specific visit. And in that visit, then 3 readings are taken. So the first reading is discarded, and the next 2 readings are averaged. And if their blood pressure is remains more than 140 or 90, then the third visit in 4 weeks is organized for them. So the initial diagnosis is taken very seriously, but once we reach to that stage, then we look at the risk factors as well, and then depending on the risk factors, the guidelines recommend either home blood pressure monitoring or ambulatory blood pressure monitoring, and the blood pressure is diagnosed on the basis of that. I think I have spoken about this in the algorithms anyway, so I will skip these. So comparing the guidelines, as I said, so the 2 main sets are the North American ones, which include the Canadian guidelines, and the European ones, and we will briefly compare them. But the one point I want to emphasize on, although there are differences in the guidelines, but there are more similarities, and I don't think there is any harm in following any of those sets of guidelines to reach at an accurate diagnosis of hypertension. So just a brief overview, definition of hypertension as per the American guidelines is more than 130 over 80, while in the European guidelines it's more than 140 over 90. The normal blood pressure range, again the Americans are a bit more stringent, so they called more than 120 systolic as elevated blood pressure to increase the awareness. But the ESC is still a bit more relaxed with that. Beyond that, the American guidelines have 2 stages. The ESC guidelines have 3 grades. One specific difference is about the age cutoff. So American guidelines, they don't discriminate on the basis of the age. Anyone, be under 65 or more than 65, they want their blood pressure to be less than 130 over 80. Again, the ESC and the European Society of Hypertension are a bit more relaxed over the age of 65, and they go up to 140 before diagnosing the hypertension. I will briefly talk about the principal areas of agreement between the American and European guidelines. In all these guidelines, the emphasis on the accuracy of the blood pressure measurement, and I think that's very important in our population as well. Before diagnosing the blood pressure, we should take every step to make sure we are accurately diagnosing it. And I think it goes a long way to make sure that later on our patients are compliant with medications and their blood pressure is treated appropriately. So all the guidelines would emphasize on repeated blood pressure measurements. They would emphasize on ambulatory blood pressure monitoring, on the home blood pressure monitoring before reaching a diagnosis of the blood pressure. And this is very important because we don't want to be diagnosing wide court hypertension, and we don't want to be under-diagnosing the masked hypertension. So if we follow their criteria accurately, we will be able to diagnose the blood pressure in its true sense. Then the other thing which is very good in these guidelines, they use risk scores. So the European guidelines, they have a score, systemic coronary risk evaluation, and the ACC guidelines have an ASCVD score. So once someone is diagnosed with hypertension, if their risk is higher, so even if someone is in the lower category, if the risk is higher, they would suggest starting the pharmacological treatment. But if someone is in the same category but their risk is low, the first recommendation will be with the lifestyle management before going to the medications. One additional point in the European guideline is they put hyperuricemia and tachycardia in the risk factors for a cardiovascular disease with hypertension. The Americans have stayed away from that, citing lack of evidence for that. The treatment targets, I've already spoken about it, and I think in the interest of time, I wouldn't go into details of that, but I think we have already spoken about the treatment targets. The one thing which is very interesting, so although the European guidelines are relaxed in diagnosing hypertension, but once the hypertension is diagnosed, the target is the same. So someone who is treated for hypertension, their blood pressure should be less than 130 or 80, regardless of which guideline you are following. So although they are strict in diagnosing, but the target after you diagnose it and you are treating it should be less than 130 or 80, regardless of either the guidelines. The primary differences, as I said, is the blood pressure status and the definition of hypertension. The older adults, age more than 65, slightly different between the two guidelines. Specific population groups. So this is something which I think European guidelines are getting it right, because they have given specific guidelines for blood pressure thresholds in ethnicities, in diabetics, in pregnant women, and in CKD patients. They've also identified South Asian communities as the highest risk factor, which is something which is missing in the American guidelines. Again, for diabetic patients, the Europeans recommend a stricter control of the blood pressure. In hypertension in pregnancy, the European guidelines have specific guidelines for them, which are missing in the American guidelines again. So I think in conclusion, I would say that hypertension remains one of the top public health issues. Accurate diagnosis and classification of hypertension is important, and the guidelines have to be followed. And as I said, for our local population, the Pakistan Hypertension League guidelines was something that I found very interesting and very applicable. And I think it might be the time to update them. I think the last update was in 2018, but it's something which is much more applicable to our population. As I said, there are more agreements than differences in these guidelines, and no matter which one we follow, they will be the right one to do the proper management. They all strongly recommend the lower blood pressure target for high-risk patients, depending on their risk scores. The last point, what I will put, although the aggressive American goals appear a bit too much to us, it might not be achievable in our population, but I think we should aim for that, especially in our population. We are a South Asian country, we have all the risk factors, and it will be important to diagnose it, treat it, and keep a stricter control. Thank you very much.